Okay, great. We're excited to have everyone on today, and we'll be recording this as well. And you can find it on our YouTube page if you look up Burrows Consulting on YouTube. We'll try to make this as quick and painless as possible, but we're excited for this new HRSA grant opportunity, the Behavioral Health Service Expansion. This is one that many people from our team have been waiting on, and they've been excited, and finally it has came out. So again, keep in mind this is H80, which is code for current full FQHC. So we want to make sure that we know you have to be a full FQHC to apply. Unfortunately, this is not available for lookalikes or other health centers. So this is for H80 grantees only. Okay. In looking at purpose and eligibility, you do have to be a current award recipient, and you do have to be willing to increase access to behavioral health services through starting or expanding mental health services and SUD. So you do have to be willing to expand both of those, which again is a newer service to the FQHC world, but many of the FQHCs are already providing such services. So this should be pretty easy for most of you. What do we all care about? The estimated awards. Usually the slides. So we'll go to the next slide here for estimated awards. The period of performance is September 1st of 2024 to August 31st of 2026. It is a 2-year grant, and year one, you can apply for $600,000, year two for $500,000. Now, keep in mind, oftentimes, even though HRSA intends to get these funded by September 1st, sometimes they do fund them after, but whatever you are applying for or planning to do for your activities, you need to be ready to go September 1st. There will be 400 awards nationally, and I'm sure it will be competitive. But again, there will be 400 awards out of the entire group of FQHCs. The goal is after these 2 years, this money will roll into your H80 grant, and that's what everyone's hopeful on. And that is what was mentioned on the HRSA technical assistance call. So I don't think there's fully a guarantee there, but it still is expected that that will be available to you. So again, this hopefully will be continued funding in the amount of $500,000 in the future brought into your H80 award. Okay, next. So per usual with HRSA, there's a 2-phase application process, and we all love grants.gov. Make sure all of your logins, your sam.gov, everything having to do with grants.gov is fully up to date. Make sure you know who the person is that can submit grants and that they're going to be around to be able to do that. And they're not going to be in a cruise ship across the whole globe, something like that. So make sure you're ready for that. They are due May 24th, but as I will elaborate on later in the presentation, grants.gov is going to be doing a shutdown for much of the week before that. So we are highly recommending any of our clients to submit by May 17th. Again, there's not too much required in your grants.gov submission other than your project abstract, your site locations, and a part of that abstract does include information from your budget and your SF 424, which has budget information. The majority of the grant, all the forms, the narrative, and everything else is due June 21st in the EHB, which is the electronic handbook. Again, check all your logins, make sure everything is up to date. They've been doing a lot of upgrades to the EHB system, and some people have had to change passwords. They've had to all of a sudden go back in and reconnect to their organization. Weird things have happened. So make sure to log in and test that so you're able to do that. And again, this is all the budget information, budget narrative, the personnel, and your big project narrative. So this is a majority of the grant, but again, you have to do both and you have to make your deadline on both of those. Focus area. So I've already talked to a couple people and they've said, well, I could do all of these. Well, HRSA wants you to pick one. So these are your 4 focus areas: quality care, safety, and integrated services, or workforce, or access and affordability, or the patient experience. I understand all the FQHCs that I work with and that I have ran in the past are all overachievers, and everyone wants to do everything. But in this case, they really want you to focus on one thing. So please consider which one you're going to focus on. And again, that is going to dictate your project abstract, your narrative, your response, your work plan, and everything else. So you want to pick carefully which focus area you want to move forward with. And then for your activity category, you must include 2 or more activities for each objective and 1 treatment activity per objective. So again, the activity categories are treatment, recovery and support services, literary review, and theoretical. So you've got a lot of things that you could do, and I'm going to give you some examples of some projects that actually HRSA provides on their webpage. So you'll want to strongly consider that and think, okay, what can I actively do? What can I do well? How am I going to meet the behavioral health substance use disorder requirements? And also have activities for each objective in looking at these areas. So what can you fund? You cannot fund a vehicle, but you can fund a mobile unit under equipment. You can fund recruitment incentives in a salary package. And again, I've had a lot of people telling me, I can't get behavioral health personnel. I can't attract them. No one wants to use them. Well, that's okay. It is what it is, but maybe you can have some incentive packages. You also can anything related to the purposes of this grant. You can fund incentives, including patient and staff incentives, but you can't do cash, gift cards, and food, which is typical for federal grants. And you cannot request year 2 any minor alterations, renovations, or equipment. I will tell you, we typically say steer clear of doing your alterations and renovations. It's always easier to fund staff than it is to fund alterations and renovations. When you use part of that money on alterations and renovations, there's a lot of things that can happen. The government can put a notice of federal interest on your property. You can have a lot of rules in who can actually work on your property and in all the things that you want. So even though you think, oh, it'd be great to get these rooms rehabbed, we always tell people, pay your staff, and then the money that you're saving on staff or the money you're generating from the staff providing services, then you can go ahead and do those renovations that you've been waiting on. Additional allowable uses of funding. And this is straight from the HRSA BHSE website because I wanted you to have their examples. So again, various costs of your projects, they'll fund anything related to those goals. These are the examples that they give, which tells me, hint, hint, that's what you want to put into your work plan because this is what HRSA wants to fund. Hiring licensed providers, CHWs, peer recovery specialists, case managers for counseling and care coordination. And I know I've never seen an FQHC that can't have more of these people. So again, you've got billable service providers, case managers, a variety of people that you can hire. Contracting with a specialist to provide staff training and technical assistance in EBPs for treatment and with MOUD. So again, that is really important in this grant is the evidence-based approaches, evidence-based practices. Make sure you're focusing on that. And again, training staff, and you could even train staff at all levels from frontline all the way to your providers. Providing group counseling for patients with postpartum depression. Again, we all know that's a huge need. It was a need at the clinics that I was just running, and we were just getting ready to start postpartum depression groups. So I know that that has to be a need where you're serving patients. That's not just special to rural Indiana. Developing a tobacco cessation program for patients receiving MOUD. I was watching especially the other night and they talked about going from one addiction to another addiction. And I was hearing a testimonial from a country music artist talking about how he's been in 8 years of recovery. And he said he went from being addicted to alcohol to being addicted to coffee. Oftentimes you go from one addiction to the other. So a lot of people that become addicted to opioid use also then will resort to smoking or other tobacco products. So again, offering that. Supporting certification, training programs, CEUs, CMEs, mentorship opportunities for providers to help them with behavioral health services. And that can be primary care providers, behavioral health, or other providers. And again, just to emphasize, these are the examples that HRSA is providing. So those are things that you probably want to consider doing for your patients. All right, patient projections. And this is something we get asked a lot. How do you set patient projections? I don't want to set something too high and not meet it, but I don't want to set something so low that why would someone give us $600,000 a year? So you need to consider that. You will be creating a patient target for your 2025 UDS that we are expecting, and HRSA is expecting that to be added into your H80 target. So you want to be reasonable. But you also want to show people reviewing this application that, hey, it's worth spending money because we are going to have an impact. You cannot double count your behavioral health and SUD patients if they're seeking both services. They're very clear on this. This has been something that I've been asked a lot in the past and has been a little bit maybe a gray area on UDS reporting. They're very clear on it now. And you also must show an increase in both behavioral health and substance use disorder patients. And now what do we want? All of the scoring. And as a grant writer, this is what I deal with a lot. Where are the points going to be? How can we score the most? We all know how competitive grants have been in the past. And a lot of times anymore, you have to get over a 90 and sometimes even over a 95, 96 to be funded. So we want to look at where the points are going to be. The need is 15 points, but 5 points if you have 0 mental health, 0 SUD, or 0 MOUD patients on your 2023 UDS. So HRSA is really targeting those health centers that were not providing services in the past. So please look at that. But if you aren't, great, you can get 5 bonus points. Somebody asked me, they said, well, we haven't been doing this. Is it going to hurt us? No, it's not going to hurt you. It's actually going to help you. 35 points for your response section, which are the activities you're going to do to meet those objectives. So those are some of the activities we talked about: staff training, implementation of evidence-based practices, adding providers, peer recovery specialists, community health workers, care managers, all those people that you know you need on your health center team. So again, looking at those activities and that work plan. Collaboration, something FQHCs do best, getting those letters of support, working with community partners, get those letters and show those strong partnerships. Resources and capabilities are 10 points, the capacity you have to support the project, showing your strong leadership and your strong commitment to behavioral health. Your impact, 15 points, and this goes back to those patient projections, but what's your baseline data and what is the estimated impact that you think you will have? And then finally, that support requested, making sure your budget is consistent with your work plan. I'm going to elaborate on this just a second. To be honest, this is where my team has lost points on a couple of federal grants recently. So I don't want you to make the same mistake we did. And I just averted the crisis today and stopped someone from redoing an entire grant that was due Monday. So what happens is sometimes at the end, we decide we want to change something in the budget. Someone from finance comes in and says, hey, we need to add this in. So we want to hurry up and get that added in. And we're like, okay, great. We've got it changed in the budget and the budget justification. So we're good. Wrong. You also then have to make sure it's in the work plan. It's in the project narrative. It's in the SF 424. What was submitted in grants.gov? Does it align with that? All the things that it changes, it might change another form. And so I'm going to tell you, this is where you don't want to be messing that up. So once you set that budget, if you take one thing away from this workshop today, please know once you set that budget, keep the budget as is. We all know that things change, and sometimes you have to change how you spend your money. You thought you were going to be able to get the psychiatric mental health nurse practitioner to come join you, and then he or she ended up taking a different job across the country. And instead, you're going to have to hire a psychiatrist 2 days a week by telehealth. You can always go back to HRSA and ask for budget adjustments and get approvals, but you don't want to be changing your budget, and that can change 10 other things in your application in the final hours before submission. So please be aware of that. And some final takeaways. Again, I really discourage alterations and renovations because there are a lot of extra paperwork you're going to have to do. Speaking as a past health center CEO who did get federal money to improve buildings, there's a lot of extra environmental checks. Are you in a floodplain? Are you in a disaster zone? Are you paying the right Davis-Bacon Act money and all this different documentation that has to be done? And yet it's so easy to pay staff, and you're already tracking your staff's time. You already have some sort of way that they're getting paid. You're tracking payroll. So all of that's already done. Making sure you do reasonable and realistic projections, but also that stretch you a little bit. You can't come in and apply for $600,000 and say you're going to serve 40 patients. That seems a little unrealistic to me. So make sure that you are stretching yourself while making sure that you can hit those patient targets. There will be a rural-urban divide among the awards, and I will say I have had even a score of a 97 not be funded because of the rural-urban divide on some grants, HRSA grants from last year. So again, they will have to do the 60-40 where nobody can go below or above that. So 60%, no more than 60% can go to rural or urban, and no more than 40% can go to the reverse. There are a lot of rules on the HRSA BHSE FAQ frequently asked questions page regarding vouchers and incentives. I am going to tell you that here's the trick. I just really probably wouldn't offer them because there's a lot of rules around them. So again, pay your staff. That's going to be the easiest way. And if you can get patient incentives through other partnerships, other local grants and things like that, that would be much easier. And then again, try to submit the grants.gov portion at least by May 17th. I know that is coming up. It is 2 weeks from today, but you want to get that done as soon as possible because you want that done before grants.gov does a whole shutdown that weekend for 4 or 5 days. So again, very important, making sure that you know who can do the grants.gov submission and you're ready to get that done early. And again, feel free to reach out to us. We would love to assist you on this grant or answer any questions that you have. This is an exciting opportunity for FQHCs, and these opportunities have not been around for a while. We've had COVID dollars, but not service expansion. I don't think service expansion dollars have been offered for over 5 years. So we want to make sure that you take advantage of this, and we're really excited about this. Feel free to reach out via email or via phone. And I will now allow for any questions if we have any. If you can unmute or go in the chat. All right. If not, we want to thank you for joining us today, and feel free to reach out if you have any questions.